If I told you that most heart attacks never needed to happen in the first place, would you believe me? I'm not talking about a miracle pill, a fancy procedure, or the latest headline. I'm talking about understanding what actually drives heart disease underneath the surface, and then fixing those drivers before they land you in an operating room or an ICU. Welcome back to the Senior Health Master Channel. I'm Dr. David Kaplowitz, MD. For decades, heart disease has been the #1 killer in the United States. Every year, hundreds of thousands of people die from it, and someone has a heart attack every half a minute or so. We've gotten better at keeping people alive once they're in trouble. Stents, bypass surgery, intensive care, these tools save lives every day. But when you step back and look at the big picture, we have not done a good job at preventing heart disease from developing in the first place. In fact, the burden of heart disease remains huge, and many of its risk factors, obesity, high blood pressure, diabetes, keep getting more common. So tonight I want to shift the conversation away from what do we do once the arteries are blocked to how do we keep them from getting blocked in the first place. To do that, we have to be willing to challenge a story many of us have been told for 40 or 50 years. That cholesterol is the main villain, and that if we just drive LDL low enough, we've handled heart disease. Let me be very clear and responsible here. LDL cholesterol does matter. Decades of research show that high LDL is a real risk factor and contributes to plaque buildup. If you're on cholesterol-lowering medication, do not stop it because of anything you hear on YouTube. Always talk to your own doctor. But focusing only on cholesterol is like blaming one match and ignoring the entire pile of dry wood and gasoline sitting next to it. What do I mean? When you look closely at the patterns in people with heart disease, you see something very consistent. Most of them are not just dealing with a cholesterol problem. They're dealing with metabolic problems, insulin resistance, prediabetes or diabetes, high triglycerides, low HDL, elevated blood pressure, and central obesity. Together, we call this cluster metabolic syndrome. And this is where the story starts to change. Insulin resistance, the situation where your cells don't respond properly to insulin, so your body has to pump out more and more of it, has been strongly linked to cardiovascular disease in multiple large studies. People with insulin resistance and metabolic syndrome often have several of these problems at once. Larger waistline, higher blood pressure, higher fasting, blood sugar, higher triglycerides, lower HDL, good cholesterol. That combination creates an environment where arteries are under constant stress from inflammation, high insulin, abnormal lipids, and oxidative damage. Over time, that's like repeatedly scratching and irritating the inside of your blood vessels. Cholesterol then becomes one of the materials that gets laid down into those damaged areas, forming plaque. So cholesterol plays a role, but it's not acting alone. The soil in which heart disease grows is metabolic dysfunction. The good news? Unlike some things we can't change, like our age or our genes, metabolic health is highly modifiable with everyday choices. So let's talk very practically. How do you know if your metabolism is in trouble? And what can you do about it? There are 5 simple markers I want you to know. 3 come from a basic blood test, and 2 you can measure at home. First is waist circumference. Not your pant size, your actual waist. Measured with a tape at the level of your belly button, first thing in the morning. For men, we'd like this under 40 inches. For women, under 35 inches. Above that, especially combined with other issues, strongly suggests excess visceral fat and insulin resistance. Second is blood pressure. You don't need to wait for a doctor's visit. Most pharmacies have a kiosk, and home monitors are inexpensive. Ideally, we want it below about 130/85 without needing medication. Higher than that, especially if you're already on medication, is a sign that your vascular system is under strain. The next three come from routine lab work your doctor likely already does. Fasting blood glucose. We want under 100 mg/dL without medication. Higher values or a diagnosis of prediabetes or diabetes point to ongoing insulin resistance. HDL cholesterol. This is the so-called good cholesterol. Here, higher is better. Above 40 mg/dL in men and 50 mg/dL in women is a reasonable goal. Lower HDL is part of the metabolic syndrome picture. Triglycerides. Unlike HDL, we want these low, ideally under 150 mg/dL. High triglycerides are strongly tied to insulin resistance and diets heavy in refined carbs and added sugars. If 3 or more of those 5 markers are outside the healthy range, we say you have metabolic syndrome, and your risk of heart disease, stroke, kidney disease, and even dementia goes up significantly. Now, here's the empowering part. For many people, these numbers can improve dramatically with changes in diet and lifestyle, often before you ever add a new medication. So what kind of eating pattern helps the most? There is no single perfect diet for every human being, but there are some patterns that show up again and again when we look at metabolic health. The more metabolically unhealthy you are, the less your body tends to tolerate large amounts of refined carbohydrates and added sugars. Diets that minimize ultra-processed foods, sugary drinks, and refined grains, and instead focus on whole, nutrient-dense foods, consistently improve insulin resistance and metabolic markers. For many of my patients with insulin resistance or metabolic syndrome, lowering overall carbohydrate intake, especially junk carbs like white bread, pastries, sweets, sugary beverages, and processed snacks, is one of the most powerful tools we have. Some people do well on a moderate low-carb approach. Others choose a more strict version for a while. That's a conversation to have with a clinician who knows your history. Along with reducing those refined carbs, we emphasize protein and whole foods. High-quality proteins, fish, poultry, eggs, dairy if tolerated, beans or lentils if you handle carbs well. Healthy fats, olive oil, avocado, nuts, seeds, naturally occurring fats and whole foods. Plenty of non-starchy vegetables. Whole unprocessed foods your great-grandparents would recognize as food. You'll notice I'm not saying, everyone needs to eat exactly like this one influencer, or you must be 100% animal-based, or you must be 100% plant-based. The key is this. Does your way of eating improve your metabolic markers? Does it bring your waist down, your blood pressure down, your triglycerides down, your HDL up, and your fasting glucose into a better range? If the answer is yes, you're moving in the right direction. And diet is only one piece. A big one, but not the only one. We also look at daily movement, walking, climbing stairs, light strength training, especially important for people over 50 to preserve muscle and insulin sensitivity. Sleep quality. Poor sleep itself drives insulin resistance and appetite changes. Stress management. Chronic stress hormones can raise blood pressure, blood sugar, and inflammation. Smoking and alcohol. Smoking, in particular, is still one of the most powerful and destructive risk factors for heart disease. When you start addressing these root drivers, insulin resistance, chronic inflammation, poor metabolic health, you're no longer just chasing numbers on a cholesterol panel. You're working on the actual conditions inside your blood vessels that make them prone to damage in the first place. So here's what I'd invite you to do after this video. Step 1. Gather your information. Write down your waist circumference, your most recent blood pressure, fasting glucose, HDL, and triglycerides. If you don't know them, that's a perfect reason to schedule a visit with your doctor. Step 2. Ask a better question at your next appointment. Instead of only asking, "How's my cholesterol?" ask, "How's my metabolic health?" Do I meet criteria for metabolic syndrome? What can I do to improve my insulin resistance? Step 3. Choose one change you can actually stick with. Maybe it's cutting out sugary drinks. Maybe it's walking 20 minutes after dinner. Maybe it's cooking one more meal at home each week instead of ordering ultra-processed food. Small, consistent changes in the right direction beat big. Extreme changes you abandon after a week. Heart disease did not become the #1 killer overnight. It's the result of millions of tiny decisions made by millions of people inside a food and lifestyle environment that pushes us toward metabolic dysfunction. But that also means there are millions of tiny opportunities every single day to push back. If this video helped you see heart disease in a new light, not as an inevitable part of aging, but as something deeply influenced by your metabolic health, make sure you're subscribed to the channel. We'll be talking more about practical ways to improve insulin resistance, protect your arteries, and keep you off the operating table. I'm Dr. David Kaplowitz. Take care of your metabolism, and you're taking care of your heart, not just for the next appointment, but for the years ahead.